So now let's proceed, and the eighth session is the part two, like basic drug information part two. Okay, this is for particularly for 9th standard, 10th standard, and 11th standard. Okay, you can use it at junior colleges as well. Okay, so that is it. So what are the objectives in this? Okay, to have a general understanding about cannabis. Okay, the three main types: short term and its long term effects. Okay, to have a general understanding about opioids and short and its long-term effects, to have a general understanding about sedatives, its short-term effects and its long-term effects. Okay, to have a general understanding about sedatives, that's what we will be seeing, and to identify ways to reduce the potential harms from drugs and to reflect their learning upon drugs. Okay, that's what we'll be seeing. So additional materials required for the teachers: piece of paper, pen, pencil, crayons, and all what we have already seen so far. Okay, so if you feel there is too much to be write up on the board, prepare in advance, writing up some sections of information text or large pieces of paper. These can be taped to wall or board. Okay, so all this you can do your get the preparations done. One thing I would like to tell you is that whenever you are taking it for the next standard, that is 9, 10th, 11, what you can do is that you can club these two sessions together. One is about alcohol, basic part 1, part 2. Okay, some things like last session was the same, so you can just include alcohol and tobacco because these are the main ones. Okay, then when you are giving it to the 9th, 10th, and 11th standard, these are cannabis, sedatives, and the opioids are the main ones that needs to be given as well. Okay, so those are not to be given for standard 6th, 7th, and 8th. Clear, everyone? Is that clear? Why we have made these two modules are different and why they are there? Yes, but in this you need to cover the basic drug education one part also. That is that also includes alcohol, tobacco as well. Clear? Okay, okay. So next thing is about the additional materials required. That this we have seen the notes you have to see. Okay, so here is what the teacher needs to read aloud. Okay, so what are the common names of cannabis? Now you people tell me. Yes, come on, fatafat in the chat box. What does cannabis mean? Yes, yes, please put it in the chat box. Be interactive as you would like the other peoples to be. Okay, charas. Yes, ganja. Okay, what else? What else is the names? In your part, in South India, what it is called? Joint, weed. Okay. What else? Bhang. Okay. What else? Ganja. Okay. Afim. Okay. So these there can be different names, and as per locality, they may calling it in a different way. So what are the common names? Ganja, bhang, dhatura, charas, sutta, sukha, goli, joint, sutta. Okay, sulfa, mal, bola, batti, gola, bola, hush, marana. Then jay bole, jahaj, dhatura, goli, sutta, ragara, puria. Okay, so these there are names. So you can also tell in what different, like in your areas what those are called, and you can include those also. So that can be done. So what does the next thing covers is teacher reads aloud the main types of cannabis and its appearance. Okay, so marijuana, dried leaves of flowers of the plant; hashish, that is the dried cannabis resin that comes in small blocks; and hush oil, that is thicky, oily liquid. So it comes in three forms. Okay, that is dried leaves, then dried cannabis resin that comes in small blocks. Okay, and hush oil, thick, oily liquid. Teacher reads out what is cannabis. So cannabis is dried leaves from a plant called Cannabis sativa. In India, it is naturally grown. It is the most common illegal drug used in the world. Bhang is the leaves of the plant, not the flowering tips of the plant, and is not illegal in India. So Bhang is the leaves of the plants. Okay. So not the flowering tips of the plant, and is not illegal in India. Teacher asked the student what are the most common ways of taking cannabis. So smoked or eaten and sometimes swallowed when mixed with fluid also, like you can bhang is one of that. Okay. So next is like about the short-term effects, and let's read out the short-term effects. The short-term effects are relax and toxolog, increase hunger, red eyes, mouth, dry throat and mouth, trouble concentrating. So these are some of the short-term effects. Teacher reads out some of the other short-term effects, and those are sometimes worried, scared, see or hear things that are not there, or reduce coordination, or even confusion. So these are some of the short-term effects, other short-term effects. Okay. So prepare in advance, like you need to prepare such a chart in advance on a large pieces of paper, or display the following long-term effects of cannabis. So these are the long-term effects. Okay. So smoke cannabis increases risk of lung and chest problems. Cannabis when smoked might cause cancer. More research is needed. Suspicious, more research is needed. Like it causes cancer, and more research would be required. Short-term memory loss and learning difficulty. So this is there, one of the effects. And then decrease motivation and concentration. So these are also the major long-term effects. When you one consumes for a longer period, okay, continuously, gets addicted, then these are some of the long-term effects. Okay. Short-term memory loss and learning difficulty is one of the major one. Okay. And suspicious of others. Also, this person is always, most of the time, suspicious of others, using a lot, often less likely to complete the school. Okay. So the one who is using this is likely that he will not complete the schooling. Understand? Okay. So that's what it doesn't mean. Then schizophrenia can be triggered by cannabis use if you have a family member or have a personal history of mental health problems. Some cannabis users do suffer mental health issues, but the majority do not. Okay. So I hope this is understandable. Like schizophrenia, normally it doesn't occur in every way, everyone. But if you have a certain kind of history, then only. Okay. So teacher reads aloud the next part, that is the long-term effects. So possible lack of interest in study or seeing friends, needing to use more just to feel normal and become dependent on cannabis. Heavy use can lead to seeing or hearing things that do not exist or are distorted, as well as disturb thinking or speech. Why is that so? Can anyone tell me? Heavy use can lead to seeing or hearing things that is due to that do not exist or are distorted, as well as disturb thinking or speech. Why is that so? Yes, because yes, it is from the category that is hallucination. Correct? Hallucination. There are three categories. So we have heard about that. Okay. Depressant, stimulants, and hallucinants. Okay. So teacher verbally explain other major negative aspects associated with cannabis use. Regular and heavy cannabis use during adolescence is associated with more severe negative outcomes than use during the childhood. Okay. The younger a person is when using cannabis, the more likely they will continue to do so as they get older. Okay. So teacher asked the following questions about cannabis to the students. What is one new thing that you know about the cannabis? Yes. What do you know about cannabis? You people tell me. What do you know about cannabis? Yes, please. Put it in the chat box fast, fast, fast. What do you know about cannabis? Okay. Stimulants nahi hai. We just talked about it. Okay. It is not a stimulant. Yes. What do you know about cannabis? क्या सुना है आपने? What you have heard about? Yes. Because there will be lots of myths those maintaining it improves concentration, it helps to focus. People say like that, you know, it's now popular among school kids. Yes, and let me be very frank with you, the new generation is stating it as a very cool. The reason behind that is that they feel that Yes, a myth as a painkiller. Now you are getting it correct, everyone. Yes, it gives hype. Okay. Cannabis can trigger schizophrenia. Okay, that we have seen. It happens only if like there is no such research that it will happen to each and everyone. If they have a family history or mental health issues, then certainly that can be. Hypotension, they feel heroic. Okay, bhang is used based on religion. Okay, guru also motivated. Okay, as a meditation form. Yes. So these are some of the rumors, actually. Okay, or myths, you can say. Okay, take to the other world. Yes, this is another thing. Okay, so and let me be very frank with you. Okay, it is said that like some of the most like world famous people. Okay, and they are the world's richest people, they are taking. So why we should not? Okay, the young generation speaks like that because it gives you creative, mostly in IT people or something like that, they think like that. Okay, not only IT, everyone. Okay, so like they see it as them as the role model. Oh, he's so cool, he's so creative, he gets so many ideas. Okay, now they can send a rocket to the, they want to create us space, go into the space. Okay, so it's all those kinds of myth, those are there. Yes. Okay, so we need to test this question. We need to like bust certain myths. Those are there. Okay, so what is one thing that you know about the cannabis? So this provides the teacher an opportunity to explore what was earlier known and issues about facts and possible myths held by students. So these were some of the myths that we talk about. Understood, everyone? Some myths about cannabis is that it is completely harmless. It is false. Okay, it is not possible to become dependent on cannabis. That is also false. Some people do, people become dependent. Okay, there are no long-term consequences. False, as shown in long-term effects. Okay, so there is no confirming evidence that cannabis is the direct cause of schizophrenia, mental health disorder involving a breakdown in relation between thought, emotion, and behavior. However, schizophrenia can be triggered by cannabis use if you are a family member, have a personal history of mental health problems. Some cannabis users do suffer from schizophrenia, but the majority do not. So globally, millions of people use cannabis, but this has not resulted in substantial rise in the number of people admitted to hospitals for mental health problems as a result of cannabis use. I hope that clears the point. Okay. Yes. So most young people get information about cannabis and other drugs from their friends. Why do you think young people ask their friends for drug information? So you will be asking this question to the students. Okay, so this provides the teacher an opportunity to explore how the fear of law, family, and possible stigmatization are some of the factors as to why many people seek out information which may not be always accurate and create more harm to the individual. So do you think that friends are always reliable source of information, and why? So you will be asking this question. So teachers should discuss the importance of the accessing factual, evidence-based, and reliable information when making decisions about drug use. It is important to emphasize that friends may not always have correct answers and that there is a much misinformation and misunderstanding about drugs in the community. So this is what we will be conveying to them. What do you think most young people do? Why do you think most young people do not use cannabis? Okay, so the teacher can provide some examples if not mentioned by the students because of most of their friends don't use cannabis because of the legal consequences, impact on future education and employment opportunities, risk to travel goals as a person may not be able to travel out of India and with a criminal record, potential risk to mental and physical health effects. Okay, on friends, family, relation, financial cost, and fear as well. Okay, so these are some of the questions that you will be answering and just conveying the message, right message, what you we have to give them. Okay, so why do you think still you people still use cannabis even when they know it can be harmful? So some issues to consider if not mentioned by the students, those who use cannabis often don't consider the possible long-term effects such as lung, chest problems when smoke. Okay, Some of the short-term effects, such as feeling relaxed, happy, or being part of a group, may be important to the person. They may also be dependent on cannabis and find it difficult not to use. Okay, so these are some of the effects. Let's go with the video.
What are drugs?
Cure for medical purposes.
If it's an unhealthy habit, it's going to be handling and understanding emotions.
And what is peer pressure? What violence actually means?
Violence is meant to bully someone.
Navchetna, a new consciousness on life skills and drug education for school children. Objectives. By the end of the session, students will be able to, first, to have a general understanding about cannabis, the three main types, and short and long-term effect. Second, to have a general understanding about opiates and short and long-term effects. Third, to have a general understanding about sedatives and short and long-term effects. Fourth, to have a general understanding about cough mixture and short and long-term effects. Fifth, to identify ways to reduce the potential harms from drugs and to reflect on their learning about drugs.
Good afternoon. Please be seated. Thank you, sir. Thank you. So this is the basics of drug education information, and this is part 2. Might be remembering something from part 1, but today we'll be discussing part 2. So let me begin by discussing about cannabis, which is a type of drug. In northern part of the country, in India, the names by which the particular drug is called, I will share those names, and then if you have any other names, we may ask you. So the names by which cannabis is commonly called in northern India is ganja, is bhang, datura, charas, sutta, sukha, goli, joint, sutta, sulfa, mal, bola batti, gola, bola, hash, marijuana, jai bola, jahang, goli, ragara, puria. So these are the names of cannabis by which it's commonly being called, and these are the names particularly in the northern part of the country. So any name that you are aware of, any name other than the names that I just discussed, that I just spoke, any name that you know for cannabis. So there are 3 main types of cannabis. That is marijuana. These are the dried leaves or flowers of the plant. The source is a plant. So the dried leaves are the flowers of a particular plant, which is called marijuana. Then hashish. Hashish is dried cannabis raisins that comes in small blocks. And hash oil is thick oil, oily liquid, which again comes from this plant. So these are the 3 types of cannabis that we are talking about. Leaves, which is marijuana, the raisins, which is hashish, and the oil, which is hash oil. Cannabis is dried leaves from a plant called Cannabis stevia. In India, it is naturally grown. It's the most common illegal drug used in the world. Bhang is the leaves of the plant, not the flowering tips of the plant. And it is not illegal in India. So, what do you think? What are the common ways of taking cannabis in India? It can be smoked or it can be eaten, and it can be swallowed. As you eat, you would swallow it, or you may mix it with some fluid. some drink. Now, cannabis, like any other drug, has short-term effects. Some of the short-term effects that we may want to know are: you relax and you talk a lot under the influence of cannabis. Increased hunger, red eyes, dry throat and mouth, trouble concentrating. These are the short-term, immediate effects of having cannabis. Again, some more short-term and immediate effects are sometimes worried, scared, see or hear things that are not there, which is hallucinating that we spoke of. Reduced concentration, lot of confusion. There are more long-term effects which include: smoked cannabis increases risk of lung and chest problems. Cannabis, when smoked, might cause cancer. Of course, more research is needed, but it might cause cancer. Short-term memory loss and learning difficulties, not being able to learn, concentrate. Decreased motivation and decreased concentration on anything that one would want to do. One becomes suspicious of others. Using a lot, often less likely to complete school. If someone would start using it, they are less likely to complete the school. There is also one mental health condition. There is also a mental health condition called schizophrenia. This can be triggered by cannabis, long use. If you have a family member or have a personal history of mental health problems, some cannabis users do suffer mental health issues, but the majority do not. So, long-term cannabis use, more use of cannabis in the long run can trigger this mental health condition called schizophrenia. There are more long-term effects. Possible lack of interest in studying or seeing the friends that one would have been used to. Needing to again use more just to feel normal, and in the long run would get dependent on cannabis. Heavy use can lead to seeing or hearing things that do not exist, which is hallucinating or distorted, as well as disturbed thinking or speech. The person may have even difficulties in talking. Regular and heavy cannabis use during adolescence is associated with more severe negative outcomes than use during adulthood. Someone using it at a younger age has consequences which are more harmful. Younger a person is when using cannabis, the more likely they will continue to do so as they get older. Now there are some questions that I am going to ask you based on what we just discussed. What is one thing that you now know about cannabis?
Cannabis is naturally grown in India.
Cannabis is naturally grown in India, yes.
It negative consequences which can impact in long run.
Okay.
It is illegal in India.
It is illegal in India, yes. So there are some myths about cannabis, is that it is completely harmless. What do you think? True, false? It's false. It is not possible to become dependent on cannabis. True, false? Again, it's false. Yes, long-term use of cannabis can make us dependent. Some people don't become dependent. That is true about cannabis. Sometimes people may think there are no long-term consequences of cannabis. What do you think? True or false? No long-term consequences. False. There are long-term consequences of cannabis use. Cannabis use will automatically lead to mental health problems such as schizophrenia. No, that is false. This is also a myth that anybody who is into long-term cannabis use will have this mental health condition called Schenophagia. No, that's not true. That is false. As we said and as we discussed, it's only a small minority who may develop this condition, but majority does not. In majority of the cases, this mental health condition does not get triggered by long-term use of cannabis. All right. So the question number 2, most young people get information about cannabis and other drugs from their friends. Why do you think young people ask their friends for this, for drug information, for any information related to drugs?
Because they're comfortable with friends.
Because they are comfortable with the friends. Okay.
It is very sensitive topic, so they can't share with their parents and as well as anybody who is elder to them. Either it could be their teachers or any mentor.
Okay, so they are not comfortable. They are comfortable with the friends, but they are not comfortable with the adults because it's a sensitive topic, and they may not be comfortable even with their parents or teachers. All right, all right. What is the other reason? Why could young people be asking this information from friends only? Any other reasons? Any other purpose with which? Yes, please.
They know they will not judge them.
They know?
Judge them.
They will not judgment. They know their friends will not judge them. They perhaps have apprehension that their elders might judge them, particularly their parents might judge them. So their friends will not judge them. What else is the reason? To get the information only from the friends?
Fear that if they ask her parents and teachers, they scold them about that.
Okay, so
Why
they will
you
get scolded.
ask this question?
Okay, so they will get scolded in the first place. Why are you asking these questions? What is your interest? Why do you want to know? Okay, so there is the fear. That's why they don't. All right, that's why they would ask from their friends. Any other reason why young people ask for the information on drugs from their friends only? Any other reason? All right, I think you have covered most of the factors. There's a fear of law, for example. It could be, it's because it's illegal, so there is those legal consequences in our mind also. So this is something which we would not want everybody to know about it. So that's why we would discuss with our friends. We might be having apprehension that with our parents, this could be the reason that they would, once they would get to know, they might get into the details of it, and we might land up in trouble. Family, of course, we are not comfortable because, of course, one of the reasons is they will judge us, and at the same time, they will be upset and they might feel uncomfortable, and then we don't know how they will respond to us. There is also a relation of stigma in the community, in our, among our, in our family, in our community. Stigma might be there. Are some of the other factors why young people may always ask for the information from the friends, but we need to understand it's not the accurate information that you would get from the friends. That is a demerit of getting information from your friends, because they don't know anything more than how much you know. So there is this possibility that whatever information you would get in the process from your friends, it will be inaccurate and inadequate. So it won't be complete information if you get it from the friends. That is something we have to have in our mind. Next question. What do you think that friends are always a reliable source of information, and why?
No, I would not agree they are a reliable source because they have many wrong assumptions as well as stereotypes a lot.
Okay, okay. Anybody else would like to try and share your thoughts?
No, because they don't have the adequate information.
Okay, okay. So again, what I just said, we need to be mindful and understand the essence of the fact that friends may not always have the correct answers. That's very important. And that there is much misinformation and misunderstanding about drugs in the community, which is available with our friends and which may get passed on to us. So it may actually not only confuse us further, but it may actually misguide us as well if we just depend on our friends as the only source of information. So in principle, two of our friends here are right in saying that it's not the reliable source of information. Friends are not the reliable source of information. Next one. Why do you think most young people do not use cannabis?
Because they are aware.
Because they are aware of what?
Cannabis.
Okay, they are aware that it's harmful. Is that what you mean?
That's harmful for young people.
Okay. Yes, you would like to add?
So because he know that cannabis is illegal drugs and he don't want to do any illegal work and he know the effects of cannabis.
Okay, okay. So they know it's an illegal drug, it has harmful consequences, and they don't want to end up in any kind of trouble. All right? They don't want to end up in any kind of legal issues or legal problems. That's why they would want to stay away from such situation, and which is why they want to avoid having cannabis. Why do you think most young people do not use cannabis?
Firstly, we know that in India the cannabis is illegal, and the second one is it may lead to a disease called schizophrenia.
Okay. So it has legal consequences. That is very important. More importantly, most of the friends do not use cannabis. So there is no way anybody would get encouraged to use cannabis. So most young people do not use cannabis. So you have friends who do not use cannabis. So you also stay away from them. So if you travel out of country, again, if you are in a position of cannabis, you can land up in trouble. So it can get into some police record, which is a criminal record. So it will leave you in a bad record for good. So you don't want to be in that record, which is why you would want to stay in such situation, away from such situation, away from such condition where you may be caught in possession of cannabis. It has a potential risk of mental and physical health, negative consequences. It affects your family relationships. It affects your friendship. It costs, because it's illegal, it has financial implications. So you will lose your financial resources in the process, and there is this fear. There is this fear which is in addition to all of this. Because it's illegal, you are always fearful that you may end up in, if caught, you may end up in prison. So these are some of the reasons. Last question, why do you think people still use cannabis even when they know it can be harmful?
Because some people like to enjoy it and they will try to copy Lord Shiv.
All right, any other reason?
Sir, because they have made their habit to take drugs regularly.
Okay, so they have become dependent on drugs. They cannot live without it. That's why they are using it. All right. All right. Any other person would like to share? Yes.
They have trapped in addiction. Their surrounding are not being essential that they could easily take off that or rid of that particular addiction.
Okay, so they are dependent.
Yes.
So because they are dependent, they are not able to stay away from it. They are not able to stay without it. Okay. Anything else would like to share? Yes.
In rural areas, people might be know about this, but they have not proper information that they can harm them or something else.
Okay, so in rural areas, you mean that there are a lot of myths, they don't have proper information, which is why they may be still continuing with the cannabis use, being ignorant of what the consequences are. Anything else?
When people take more tension, they think that when we take alcohol, they feel good and something.
Okay, so same thing like alcohol, they may want to try with cannabis because they want to stay away from stress, stay away from the tension. Okay, okay, all right. So this is one more myth community has, people have sometimes. Yes?
Sir, because they become cannabis addicted.
Because they are dependent on cannabis, they cannot live without it. So they are dependent on it, that's why they use it. So those who use cannabis often don't consider the possible long-term effects such as lung and chest problems when smoked. Some of the short-term effects such as feeling relaxed, happy or being part of group may be more important for some people. That's why they use cannabis. Or they may be also, as you rightly pointed out, some of you did, or maybe they are dependent on cannabis and they may be finding it difficult to stop using cannabis.
Okay. So second session is about learning about opioids. Okay, so note for the teacher, there are three categories of opioids in India. Opium, that is including Doda, Fuki, poppy husk. Okay, second is heroin. And the third one is pharmaceutical opioids, variety of medications of opioids, groups such as tramadol. Heroin is one of the most widely used opioid in India. So the common names, so you will be asking like if in case they know, or you will just mention these are one of the common names like Afim, Doda, Khatu, Boogie, Smack, Heroin, Puria, Chitta, Doda, Afim, Bukki, Saman, Afim, Kalamal, Nagni, yeah, Kalimai, Set, Kalamal, Nagina, Post, Brown Sugar. Okay, names are numerous. So in case like if you people know any, you can just put it here. Okay. If you know any other names by which you know words, then you can just put it here. Okay. So then the teacher reads aloud like opioid is a depressant drug. Okay, so it is a depressant category. Slow messages between brain and body. Opium is hardened juice from opium poppy plant. Okay, heroin from poppy plant following a chemical process. Pharmaceutical opioids are made from artificial substances, often copying a natural product. Okay, so there are natural ways as well as artificially these are made. Then how they look like. Okay, so heroin is white or off-white powder, granules like sugar or small rocks. Okay, opium is sticky or hard, dark brown material in any form or shape. Pharmaceutical opioids are commonly liquid or powders. Teacher reads aloud common ways of taking opioids. Injected, but can also be snorted or smoked in table form, like for example, in tablet form. For example, tramadol, it is solid. Okay. So there are different ways, like it can also be injected, it can also be snorted or smoked. Snorted means snort. What do you call it as like through the nose, nasal, okay? And smoked in the tablet form also. In terms of like tramadol, it is also solid. Okay, clear everyone? So these are the ways of taking those. So teacher writes about the following short-term effects of opioids like slurred and slow speech. Okay, reduced appetite and vomiting, relaxation and drowsiness. Teacher reads aloud other short-term effects or immediate effects like intense pleasure, happiness, trouble concentrating, slower breathing. Then there are the long-term effects like sadness, constipation, dependence. Okay, so these are some of the long-term effects, sorry. So teacher reads aloud other long-term effects like damaged heart, lungs, liver, and brain. Veins not working due to injecting the drug. Those people who are injecting that, then there are veins issues. Okay, risk of HIV and hepatitis B, inflation of the liver, that is due to sharing of needles or injecting equipment during the process of injecting heroin. Okay, so mixing opioids with other drugs such as, for example, excessive drinking of alcohol greatly increases the risk of overdose, which may lead to death as a result of stopping breath. So if you are mixing opioids with other drugs, you're mixing this both, then it is very, very fatal and can lead to death as well. Okay, so note for the teacher that heroin is injected into vein, it produces a surge of euphoria. Okay, so this feeling is not an intense when it is snorted or smoked. Every time many heroin users transit from smoking or snorting to injecting of the drug as they wish to ensure they receive the maximum amount of drug with minimal loss, both financially and the drug itself, which can occur when heroin is smoked or snorted, so that there is no wasted and they can use it maximum in maximum cases. Okay, and even for the effect also. So it directly affects, and the effect is larger in the same quantity. Okay, yes. So these are some of the other effects. So note for the teacher, like in India, the primary sedatives used. This is about the third session. Okay, that is learning about the sedatives. So note for the teacher, in India, the primary sedatives are called benzodiazepines and developed for use of pharmaceuticals particularly. They can vary considerably in their potency and duration action. Okay, so like long-term, intermediate, and short-acting. Benzodiazepines are known by their chemical generic name or their brand name. Okay, in such case the drug is exactly the same, it's just made by a different company. For example, diazepam and Valium, then lorazepam and Ativan, alprazolam, Xanax, clonazepam, and clonopine. Okay, the other commonly used sedatives in India are and antihistamines. Okay, so the names are very different, and even I'm unable to spell. I'm sorry about that. Okay, some of the names like particularly. Okay, so chlorpheniramine. Okay, and the promethazine. Okay, along with non-benzodiazepines, okay, hypnotics. So similar to benzodiazepines in nature with many effects on the body, but different. And so these are the forms of sedatives and those are available. Okay, so those are for medical purposes, but then these are being used as drugs particularly. Okay, those who take it on non-prescription or not to the doctors. It is like that. Okay, so now the next thing is like teacher reads aloud common names of sedatives in different parts of India. Okay, so these are some of them which are common, or you can just go through that and you will find that. Okay, the like Penargan, then diazepam, Avil, Fortwin, Goli, Khaki, 10 नंबरी, Alprax, नींद की दवाई, टिड्डे, बादाम, गोली, सामान, टोटा, छोवा, buta, then Lupigesics, Cipla, Feed, Kazu. Okay, so the names are like vary. Okay, so these are just nothing but the sedatives. Okay, so teacher leads around among the common ways of taking this sedatives. Okay, so compose and all, like we don't need to tell the children because that is not the part of this module. Okay, so compositions, like you can Google it and you will find the compositions. Okay, but that should not be like is not the part of the module, and we'll stick to the module. Whatever is in the module, that is only what we need to deliver. As simple as that. Am I okay? Correct? Understood? Okay, so that is what it is. We need to stick to the model. So anything that is like you need extra knowledge, you can always Google, or you can I have certain PDFs also. I can share that. Okay, so that is, but that is not just, it is just for knowledge. We should not use it anywhere because we will not be going aside even for a single word out of this context. Okay, clear everyone? Yes. So teacher reads aloud some common ways of taking sedatives. It is normally swallowed or injected. Teacher reads aloud what are sedatives. Sedatives are depressant drugs. They slow down messages traveling between brain and the body, commonly prescribed by doctors to relieve stress, anxiety, and to help people get a sleep. So these are basically like for anxiety patients. Okay, those who are suffering from you can say even panic attacks and all. Okay, so such kind of people are given, and that too by doctors only. Okay, so these has to be taken on by prescription only. Okay, from the prescribed or medical practitioner, and that too he should be like, you can, he is a master's and he is already qualified for that. Okay, that needs to be followed. So teacher reads aloud like what sedatives are, like tablets, capsules, some are liquids inside the capsules. Okay, so teacher writes on the board the following short-term effects of the sedatives, like relief of stress and tension, okay, depression and confusion, and you feel sleepy. Okay, so feeling isolated, headache, or dizzy are also some of the short-term effects. So teacher reads a lot about the short-term, if other short-term and immediate effects, those are there. So not clear thinking. So there will be some issue, like you will not be able to clearly think, blurred vision, or lack of energy, drainness will be there. Okay, so these are some of the some of the short-term effects. Now about the long-term effect. Long-term effects are like you get dependent on that. So dependence, not thinking clearly, personality change, you get irritated. Okay, so these are some of the long-term effects. So note for the teacher, if injecting sedatives, this can result in vein damage, infection, including hepatitis B, hepatitis C, HIV. Okay, so and damage to the body organs as well. So teacher reads a lot about the other long-term or immediate long-term effects. Okay, those are like memory loss, anxiety, feeling worried and depression. Okay, so difficulty with sleeping. So these are some of the long-term effects. Okay, fourth session, that is learning about the cough mixture. So now we'll be learning about the cough mixture. So for what we have done, we have covered the opioids, we have covered the sedatives, and now we are covering the cough mixture. Okay, so teacher reads aloud about the common names for the cough mixture, and this is very common because it is easily available. One can get the cough tablet, and it is like they can easily get it at the counters. Okay, some of the yeah, some experts say it is not advisable to introduce new drugs or names of drugs in front of teenagers. Look, this module is made by the government of India, okay? And that too from the world's like one who is very experienced, okay? So these is, and they have insisted it, and it is typically made for that. You can see the module, okay? So there has been a lot of thought process. Okay, even sex education, people used to think earlier that should not be introduced. Okay, but now it is. So it's only how we take. Creating awareness is the main thing. So how you can get, rather than these people learning it from somewhere else, if you tell them now, that is the main. I hope you got my point. Khalid, yes, Khalid Wani, got it? Okay, so even sex education also, people used to say why we should be talk about sex to the children's. Okay, but now it has been taught. Even I believe it should be now in the sixth standard, seventh standard also. They are taught about it, fifth, sixth standard also. Okay, about genitals and all. So it's not like that. So we need to speak, we need to create awareness, and that is only possible when we educate them properly. Education in proper way is the most important part. So that's what we are doing. We are talking here about the type, what are those, okay? Instead of like they going and hey, what is this white powder, take it. If someone tells the child, then the child doesn't know, oh, it is sugar maybe, okay? But now the child knows. So this is the difference, you see. Understand? So now they know, like, okay, how does it look? Okay, this is it. Okay, it can be this. So they can now, once they are aware, they have the knowledge, they can react in that way. That's what we are teaching them. So I believe your point is answered. Okay, thank you. Okay, teacher reads aloud the common names for cough mixtures in India, like fancy drill, Corex, Torex, syrup, tonic, fancy, CC, Shishi, RC, fancy, Sonpari. Okay. And teacher asks the students to do not. I have seen this. I have seen people like what they call it here. I believe they call Goody also, or some other names. Okay, in Maharashtra there are so many names out there. Okay, so they talk about it, and literally people like they need 2-3 cough mixtures, and the students like they're trembling hands and every time. Okay, so the like side effects are very high. Teachers reads aloud those cough mixtures, looks alike. It is a liquid in orange or colors. Like it is in various colors. You can see like these are the cough mixtures. Those are available. Okay. So teacher reads aloud what is cough mixture. Medication is treat medication to treat cough and related condition. That's what the cough mixture is for. Many brands use codeine in form of cough syrups. Some cough and medicines are mind altering at higher than recommended dose. Codeine is an opiate. Okay, so it is a family, comes from the opiate, and effective for cough, but if misused can lead to dependency. Okay, so most common ways of taking it are solid. Some people mix cough syrup with flavored drinks or even alcohol, and that is another, like it is also leads to a fatal thing. Okay, teacher writes on the board following short-term effects of cough mixture, like sickness in stomach, vomiting, dizziness, or diarrhea. Okay, so some of other immediate effects are like allergic reaction, slurred speech, blurred vision, or relaxed and calm feeling. Okay, teacher writes on the board following long-term effects of cough mixture. This can also be written on a large piece of paper and placed on the board. You can write it down. Some long-term effects are like psychosis, seeing or hearing things that do not exist. Okay, depression, psychological and psychological dependency, depending more of the drug when not required, depending more on the drug, okay, when not required. So these are some of the long-term effects. Okay, so teacher reads aloud about the long-term effects, stopping of heart, breathing, brain damage, okay, and all those. So cough mixtures with codeine, when used as prescribed and over short term to reduce coughing, is very effective and acceptable. So when used as per the prescription, okay, whatever it is, then the as per the prescribed, then it is good, like it is effective and acceptable. When any medicine such as cough mixture with codeine are used without a doctor's prescription, negative effects arise and can lead to dependency. That's what we need to read aloud. So fifth session is about dealing with different drug use situations. So we will be giving here the situation and we'll be telling them, asking them how to deal with it. We'll be telling them. So the teacher reads out the situation with a couple of questions to the students. For the teacher, the learning intention of this activity is for students to identify ways to reduce the potential harms from drugs and to reflect on their learning about drugs. So what they have learned so far. Okay, so what we need to reflect it back so far, whatever we have taught to them. So we need to just get back to that. So situation one, you and your friends are worried about a friend who seems to smoke cannabis each weekend and is also taking cough mixture with codeine during the week. You all know that your friend has been missing school, borrowing money, and has dropped out of lots of activities, both in and out of the school, that he used to do with you along with. Okay, so what do you think are the possible harms to your friend in this situation? So that will be your first question. Next will be, think of 3 options and choices that would help you to manage the situation and reduce the possible harm to your friend. So this will be the next question. Once you are given the situation, you'll ask about the first question, then the second question. So you'll take the answers from after the first question, and then you will be putting the next question. So note for the teacher, some possible answers on harm could be various health risks associated with use of cannabis, like short-term and long-term effects, dependency, loss of education, becoming a school dropout, loss of money, losing friends, and becoming isolated, problems at home, etc. So whatever we have taught them, okay, are they reflecting the same? Okay, or we need to, these are some of the question answers that we are expecting from them. Okay, so options could be alter friend to, like what would be the answers, like what could be the options? Okay, alter friends to risk of using drugs and negative impact, just stop him from using the drugs and the negative impact. Feeling the need to privately speak to a friend of the consequences of their use, so you can speak to them about that. Okay, and so that also you tell him about the consequences or her about the consequences. Providing support to the friend, checking with friend if agree to get help. Okay, so check whether he is agreeing to get help or convince him for that. Providing support to them. Okay, not rejecting the friend, and this will likely encourage further use of drugs. So this is one of the most important part, because if you make him isolated, then it will again cause him to use it more. So explore if possible for friend to reduce their use of drug, etc. So note for the teacher, if the time permits, the teacher can read out 1 or 2 more drug use situations as below, okay, with questions and possible responses. Drug use situations are good interactive exercises for the teacher to gain insights of how students would respond to the real world situations. So this is what we want. So how they would respond to the real world situation. This is what we are educating and creating an awareness, being this very sensitive about it. Because in real world, somewhere someone is going to 100% face this. Okay, either their friend will be, or either the group, then someone will be there, or they themselves fall prey. So it is very important that we consider these situations. Okay, situation 2, you can catch the same school bus as your brother's friend who is in standard 12. The friend asks you to take some cannabis home with you or your brother. He asks you to come to the back to the bus so he can give it to you without the driver seeing it. Okay, so he wants to hand over the cannabis parcel. What do you think are the possible harms in this situation? Think of 3 option choices that would help you to manage the situation and reduce the possible harms to your brother. So some possible harms are like getting involved in illegal behaviors with police involvement, possession of cannabis is illegally in India, possible curiosity to use cannabis, change relationship with brother, obliged to get to do this task again, because once he does this, then he will be asked to do it on a regular basis for brother and maybe others, etc. Okay, so options could be refuse to get involved and not be pressured, inform brother's friend that such activity is illegal, inform brother's friend of the negative effects of cannabis, best the person speak to the brother directly or not involve others to do such kind of an activity. Okay, so these are some of the another one is like drug situation 3. You are walking home from school with your older sister. One of her friend drives up to you on their two-wheeler and offers you both home on their two-wheeler. Like, we want to drop you. You smell alcohol and think that your sister friend looks drunk from alcohol. You know the person should not be driving and are worried about getting into the two-wheeler. Okay, so what are the possible harms in this situation? Think of 3 option choices that would help you to manage the situation and reduce the possible harms to you and your sister. Okay, some possible harms are that there could be an accident and injury may happen. It is likely that there will be no helmets, which could be dangerous, and it is also against the law. The driver will be fined. Options: inform the person that you and your sister are happy to walk as it's good for exercise. It is most likely that there will be helmets for all of us as a safety precaution. The offer for a ride can be declined. Be firm what you do not like riding on two-wheelers and cannot accept. Inform the person that your parents are forbidding you and your sister to ride on two-wheeler and do not wish to upset them or make them angry. But I would suggest here, say I. Yes, everyone remember? I do not like and I do not want to be on this two-wheeler. That's it. So I situation is more better option than this. Okay. So the 6th session is about the drug quiz, what you have learned about the drugs. Okay, so we'll be taking a quiz after this. Okay, so this is for the 9th, 10th and 11th standard. So upon the completion of the module 5, the teacher will conduct a short drug quiz. The quiz is to help. Here the session is ending. Okay, so we have covered here even the sedatives part as well. Okay, and the cough mixtures also. Okay, we have covered the situations also. So here the module ends. So you will be taking a quiz on that. So upon the completion of module 5, the teacher will conduct a short drug quiz. The quiz is to help the teacher and student to find out what was they learned about drugs and understanding about cannabis, opioids, sedatives and cough mixtures and associated side effects. Okay, so teacher should provide a piece of paper or the student should take a piece of paper from their notebook to undertake the drug quiz. Okay, teacher reads aloud each quiz question. It is important to ensure that each student understands the question before moving on to the next question. Okay, so now we'll take the videos. We'll go ahead with the visuals.
Now we'll talk about opioids. So I'll begin by sharing some common names of opioids in northern India, including Delhi. So the names are Afim, Doda, Khattu, Buggi, Smack, Heroin, Puria, Chitta, Saman, Kala Mal, Nagni, Kali Mai, Kala Mal, Posht, and brown sugar. So these are the common names of opioids in this part of India, northern India, that we know them of commonly. Any name that I might have missed? Any name in addition to these names that you know of? So what are opioids? Opioid is a depressant, which means it slows down the messaging between the brain and our body. Opium is hardened juice from opium poppy plant. The source is a plant, poppy plant. Heroin from poppy plant following a chemical process is produced. Pharmaceutical opioids, these are artificial substances often copying a natural product, which is heroin. So what do opioids look like? Heroin is normally a white or off-white powder, or granules like sugar, or small rocks. Opium, it's sticky, hard, it could be hard, dark brown material in any form or shape. Pharmaceutical opioids commonly are liquids or powders, either in the liquid form or in the powder form. The most common way to use them or having opioids is injecting, but they can also be snorted or taken through the nose, or they can be smoked. So there are some short-term effects, like other drugs, there are some short-term effects. So short-term effects are slurred and slow speech, reduced appetite and vomiting, relaxation and drowsiness. So there are more short-term effects. Intense pleasure, lot of happiness, tremendous pleasure, lot of happiness, trouble in concentrating on anything, and slower breathing. It affects the way we breathe. Breathing becomes slower. There are also some long-term effects which include sadness, feeling sad, constipation, and your dependence. So it's difficult to stay without them, you become dependent. As the use increases, the heart gets damaged, lungs get damaged, liver gets damaged, brain gets damaged, veins not working due to injecting, repeated injections, risk of getting HIV, might have heard of a health condition, HIV, it's an infection, and hepatitis, which is inflammation of the liver due to sharing of needles. If people are going to use needles and share needles, it may lead to HIV and hepatitis because of sharing the needles during injecting. One of the major negative consequences of opioids is if mixing opioids with other drugs, such as, for example, excessive drinking of alcohol greatly increases the risk of overdose, which may lead to death, overdose death, as a result of stopping breathing. The person may stop breathing. So if you mix opioids with alcohol, and in the process one may lose breathing, and which means the heart will stop functioning which means the person may die. So that was opioids. Now what we will discuss is sedatives. We just discussed about the opioids. Now what we will discuss is sedatives. Sedatives, again, they have some common names that I will just share with you. Some of the common names that sedatives, these are the drugs which are available, which you may get from a chemist shop, a druggist shop, a pharmacy. They include Phenargan, Diazepam, Evil, Fortwin, Goli, Khaki, 10 number, Alprex, नींद की दवाई which is sleeping tablets, Tiddi, Badam, Saman, Tota, Choba, Cipla, Feed, Kaju. These are some of the names of sedatives, sleeping tablets. So the commonly sedatives are taken either swallowed or injected. So either you take it orally through your mouth or you inject them. Sedatives are depressants. As far as the category of drug is concerned, psychoactive drugs, these are depressants. They slow down the messaging between the brain and our body. Commonly, they are prescribed by the doctors to relieve stress and anxiety and to also help people in sleeping. Some people may have difficulties in sleeping, so they may be prescribed to have certain medication for sleeping. So these are the sedatives which are prescribed by the doctors as well. They come in different forms. Mostly they look like tablets. They could be capsules, and some are liquids inside the capsules. So there are some short-term effects of sedatives. So relief of stress, and tension. You feel isolated, feeling isolated. Depression, and confusion, headache, you feel sleepy, and you feel dizzy. More short-term effects are not clear with the thinking, the way we think, we are not clear about our thoughts, blurred vision, lack of energy. Some short-term effects are dependence, personality change, irritated, and not thinking clearly. Okay, so that was the short-term effects. Long-term effects, dependence, irritated, and not thinking clearly. These are the long-term effects of sedatives. Other long-term effects are memory loss, anxiety, feeling worried, and depression, and difficulty in breathing, in sleeping. Difficulty in sleeping. So now we'll discuss about the cough mixtures. Again, cough mixtures has some common names in this part of the country, which is Fincy, Corex, Torex, syrup, tonic, CC, Shishi, RC, Fancy, Sonpari. So these are the common names for cough mixture in northern India. Any name that you can think of, you might have heard of cough mixture.
Terbutaline.
It's a liquid and it comes in the range of colors. It could be blue and some other color as well. It's a medication to treat cough and related conditions. Many brands use codeine in the form of cough syrups. Some cough and medicines are mind altering at higher than recommended dose. Codeine, which is the main drug which is found in the cough mixtures, is an opioid and effective for cough, but if misused can lead to dependence. So common ways of having cough mixture is swallowed, you take it orally, from your mouth. Some people mix cough syrup with flavored drinks or even sometimes alcohol as well. So it has short-term effects. Some of the short-term effects are sickness in stomach upset, or vomiting, feeling dizzy, and diarrhea. More short-term effects are some allergic reactions, slurred speech, blurred vision, not being able to see properly, relaxed and calm. There are also some long-term effects of having cough mixtures. There is a mental health condition which we may call psychosis, seeing or hearing things that do not exist. Depression, physical and psychological dependence, needing more of a drug when not required. So every next time one would have cough mixtures, you need more of it. So you get gradually dependent on cough mixtures. Long-term effects, stopping of heart and breathing, brain damage. Cough mixtures with codeine when used as prescribed or short-term to reduce coughing is very effective and acceptable. When any medicine such as cough mixtures with codeine are used without a doctor's prescription, negative consequences arise and that can lead to dependence. So we have a situation now. We have one small case scenario which we will share with you. We would like to have your response to few questions, that what would you do if your friend, if someone you know lands up in such situation, what would you do? How would you help that particular person? So there is this situation. Situation is you and your friends are worried about a friend who seems to smoke cannabis each weekend and is also taking cough mixture with codeine during the week. You all know that your friend has been missing school because of this, borrowing money to buy it, and has dropped out of lot of activities from the school that he used to do with you. Lot of activities this student used to do with you, but he has now of late dropped out of those activities because of these two things. On weekends, he is having cannabis. It seems that he is having cannabis. You are not very sure, but you have some information to suggest that that is happening. And weekdays, he is having codeine with cough mixture. Okay. So the question is, what do you think are the possible harms to your friend in this situation?
He is medically unfit because he is out of many activities which earlier he could do very well. So he is out of the activities in school. So he is medically unfit now.
First, you have to think what are the possible harms to your friend? What are the harms to him because of this particularly? Cannabis use and cough mixture.
His posture, his ability to stand, his stamina is very low.
Okay. So overall health, overall well-being will be affected. Okay. Anything else? What else may happen to your friend? Yes, she has something to share.
He lost his many of years of his life. Lost his life.
Okay, so he may lose his life. He may lose many years of his life if he continues.
Many years, yes.
All right, yes.
It will harm his all organs.
It will harm his organs.
Yeah.
Okay.
And he or she get fatigue easily.
Okay, will feel tired easily. All right. Okay. Somebody wants to share on this side? Yes.
It is a trouble to grow the brain development.
And it will affect his growth and development. Okay. second question, think of 3 options, choices that would help you to manage the situation and reduce the possible harm to your friend. Please understand, you got to know the person is having cannabis on the weekend. On the weekends, the person is having a cough mixture which has codeine, because of which now he is not taking interest in the activities that he used to take interest in earlier. So he is still in the school, he is still with you in your school. Now, while he is still in your school, while he is still with you, what are the options, 3 options, think of 3 options or the choices that would help you to manage the situation and reduce the possible harm to your friend. So these are the 3 things in which, 3 ways in which you can help your friend, or 3 things that you may want to do that you would help your friend to still stay away from the harm and to still stay in the school and get over with the situation, overcome the problems. What are the 3 things? Any 3 things, any 3 choices that you may want to make which will be in the interest of your friend in this situation?
For example, he used to play with me football, and now he avoid that game because he thinks is very much tiredness after he feels very much tiredness after playing that game.
Okay.
And another situation will be he participate with me a lot with quizzes and very much competitive exam. Now he feel that is very well and more competitive, tough. So he is avoiding these kind of things. Earlier he used to do that with me. And third case, I will guess his schedule of working and his meal. He's avoiding healthy food instead of he's more into things which can harm him in many other ways, like junk food, and because he loses his determination power.
Okay, so he is losing determination power, he is losing interest in activities that he was doing with you, as an example. But what I want to know from you, as far as the second question is concerned, what are some of the options, what are some of the ways in which you would like to help your friend? How would you help this friend in this situation? What could you do in this situation? You have something to add?
First, we will discuss with him that what is the problem, why are you taking it.
Okay.
And second thing is that when we are discussing, we have to careful that if we get something wrong, he think that she was telling me something wrong, and it was not good. Sometimes he don't know that what causes he will get from that. Sometimes he start taking it and he don't get that what he was doing. So we have to tell him that it was not good, it was very bad for you, it was bad for your body also. So when we start, we have to think about it, and when our friend start, we have to discuss with him that what's the problem, why you started, who said to you, who advised you, like that. So
thank you, thank you, thank you, thank you very much. She said very critical points. She said that she will discuss with the friend, she'll be sensitive with the friend in discussion, she'll be mindful of how to discuss, what to talk, how to take up the topic. She also discussed about what could have been the reasons for him to get into using cannabis or using cough mixtures. She would like to know. Then she would like to discuss who are these friends who might have introduced him to maybe cannabis and maybe to cough mixtures, who may have introduced these drugs, these may have landed up this person in this situation. She also spoke of very important aspects, is that we have to talk about the positive aspects of a person, that you were taking interest, you were part of all our activities, you were a great buddy in the classroom. What has happened, why you are not taking interest in the classroom, what is causing you to get into this habit of getting into cannabis. So these are the very useful and meaningful ways in which we certainly can help our friend to stay away from the harms, further harms of cannabis use or the cough mixture, and ensure that the student does not drop out, still stays in the classroom, which is why being sensitive in the process is extremely important. You want to add anything else?
We should sensitive, because if we say him directly, then he thought that she was telling me something wrong, and he get mad at them and start fighting also. It happens also. That's why we have to be sensitive.
So we have to be sensitive. We have to be not only sensitive, we have to be not be judgmental at all, and we have to be sensitive and not be aggressive, not make the person feel bad about what the person is doing, yet be able to convey the message in terms of what are the causes, what could happen if you continue with this cannabis use, what may happen. So you will discuss about the health consequences associated with cannabis use, long term, short term, dependence, that one may get dependent. One may also lose education, because if you, at some point, if you do not stop, right now the person may have withdrawn from the activities in the school. Tomorrow the person may drop out from the school itself, so you may lose the opportunity of getting educated in a school. Loss of money, you are going to use money to procure the, either irrespective of you procuring the cannabis or procuring the cough mixtures, you are going to lose money. And you may lose your friends, the friends that you have. While you may lose your school, while you may lose your education, you may also lose us as friends who are with you. And you may become isolated, and there might be problems at home once the family gets to know, once the parents get to know. Options could be that we may alert the friend, as you rightly pointed out, and discuss the risks associated with it and the negative consequences, particularly. Feeling the need to provide the information and speak privately. We should speak with such people, with such friends privately, not in public, and be very sensitive, as she rightly pointed out. That's very important. Provide support to a friend, because person is still our friend, person is still part of our class. Checking with a friend if agree to get help. If they want to get help, you may want to help them in getting some professional support. Go and talk with someone who has more information and knowledge about the subject, and not rejecting the friend at all, as this is likely to encourage them into further get into the drug use further. It will not help them at all if we reject them and if we are uncomfortable with their behavior. And we may also want to discuss with this friend particularly about how we as friends can help them to reduce the drug use. The fact that the person is having cannabis on the weekends, how you can reduce it. The person is having the cough mixtures during the weekdays, how can you reduce them? And how you can get involved in the activities more. So these are some of the ways in which we can help our friends who may get into this kind of situation that we have just discussed with you.
So next is the question. Okay, questions like quiz we'll be conducting, and the quizzes like mixing opioids with drugs greatly increases the risk of overdose, and that may lead to death. True or false? Can you please answer, everyone? Yes, I want everyone to answer. So mixing opioids with other drugs greatly increases the risk of overdose and may lead to death. True or false? Okay. Okay, true. What is the most commonly used illegal drug in the world? Yes, what is the most commonly used drug in the world? Illegal drug in the world. Yes, keep on typing, go on, go on. Angelina, you are wrong, Angelina. Okay, Rafik are wrong, Sonia wrong, wrong, Huma wrong, Ashish wrong. Okay, so please pay attention, okay? So all these things are cough syrup. Okay. So what is the most commonly used illegal drug in the world? So you will come to know what is the answer. Okay, you keep on answering. Okay, as a drug, a sedative, as a drug, a sedative is classified as one of the following. Write down one: depressant, stimulant, or hallucinogen. Yes, what it is? Please type. As a drug, sedative is classified in which of the categories? Depressant, stimulant, or hallucinogenic? Yes, you just answer that. What are the three main types of cannabis? Name one of them. Three main types of cannabis. Yes. Name one of them. Okay. So these questions you need to answer and to get the certificates. Everyone, please ensure, because you will be getting all these questions also. Because for certification, your attendance is mandatory. For certification, your answering is also mandatory, because we need to follow the test rules as per the Government of India and the modules, and we will be giving you a test and you need to pass that test also. Okay. Everyone, please understand. Yes. Yes. So there are three main types of cannabis and name one of them. Okay. So when codeine-based cough mixtures are not used as prescribed, negative effects arise and can lead to dependency. True or false? Or do not know? Yes. When codeine is mixed, codeine-based cough mixtures are not used as per prescription, negative effects arise and can lead to dependency. True or false? Yes, type it. Okay. Okay, so teacher collects the pieces of paper from the students. Once this is completed, teacher will verbally provide the correct answers to each of the question. With each correct answer, the teacher can ask among the students and show hands. What are those? Okay, so you will be answering also to these questions. Okay. Yes. If many students do not get the correct answer, it would suggest to you, like correct answers, it would suggest some misunderstandings. Okay, so there are misunderstandings. So some of you are not answering, that means you are not understood it completely. Okay, so if further explanation or rephrasing of topics will need, consider at a time convenient for the school or the teacher. Okay, for correct answers, annexure 5 is there. But however, in this answer is true. What is the most commonly used illegal drug in the world is cannabis. Okay, and depressant. Then there are three main types of, you can name them, and the codeine base, yes, true, it is. Okay, so all three are there. So let's go ahead with this. You will get the answers also.
So this is the last exercise of this session, part 2. It's a small quiz of 5 questions. So for this, what you need to do, please write down your responses only against a particular question. Question number 1 and the response in a separate sheet. Please do not write your name on the sheet. Once the quiz is complete, once we have asked all the questions, once you have written all the responses, we will collect all the papers, all the sheets from each one of you. Okay? All right? Is it clear? Yes, sir. All right. So first question. Mixing opioids with other drugs greatly increases the risk of overdose and may lead to death. True or false? Please don't say it. Please write the response. True or false, or do not know. Mixing opioids with other drugs greatly increases the risk of overdose and may lead to death. True, false, or do not know. Response, please. Please write down. Can I ask the second question? Yes, sir. Okay. Second question is, what is the most commonly used illegal drug in the world? What is the most commonly used illegal drug in the world? We can ask the third question? Yes, sir. Okay. As a drug, a sedative is classified as one of the following. There are three options. One of the option is correct, which you will write. And the three options are depressant, stimulant, or a hallucinogen. Depressant, stimulant, or hallucinogen. Either of these three, any one is the correct. Please write your response against question number 3. That is question number 3. You can ask the next one. Yes, sir. Okay, question number 4. There are 3 main types of cannabis. Name one of them. There are 3 main types of cannabis. Name any one of them. When codeine-based cough mixtures are not used as prescribed, negative effects arise and can lead to dependence. True or false, or do not know? When codeine-based cough mixtures are not used as prescribed, negative effects arise and can lead to dependence. Is it true? Is it false, sir? You do not know. So we have collected from all of you? Yes, sir. Sure? Yes, sir. Okay, so let's discuss. So let's discuss the responses. Mixing opioids with other drugs greatly increases the risk of overdose and may lead to death. What is it? True. It's true. What is the most commonly used illegal drug in the world? Cannabis. Cannabis. Okay. Third, as a drug, a sedative is classified as one of the following. It's a depressant. There are 3 main types of cannabis. Name one of them. That is the name of the drug. Hashish, marijuana, and hash oil. Hashish, marijuana.